Hello and welcome to Amra Circle. I'm your host Deeksha and I'm so excited to introduce this platform that brings parents, educators and experts together to discuss all things parenting. For we all know it takes a village to raise a child. This podcast will shed light on different issues, questions and topics relevant to the early parenting community. Enjoy our musings every week as my team and I take pressing parenting topics and break them into 20-minute episodes. Subscribe to Amra Circle on Spotify or Apple Podcast or wherever you listen to your podcast so you never miss an update. The birth of a child is a pivotal time in the life of a mother and her family. The outcome of childbirth, however, is not the only factor of importance in a mother's well-being. Research suggests that the way in which a woman experiences pregnancy and childbirth is vital for the mother's relationship with her child and her future childbearing experiences. Pregnancy involves making multiple decisions, and one of the most important decisions a mother along with her family makes is the choice of a healthcare provider for pregnancy and childbirth. In today's episode, we will be discussing the various childbirth options, healthcare providers, and how you can go about choosing the right partner and optimal birth setting. We have with us today Pranjul Tandon, a certified childbirth educator based in London. She's the founder of Womb Beyond and ReadyBabyGo and has worked with parents from across the globe. Welcome, Pranjul. It's good to have you on Amra Circle.
Thank you so much. It's a pleasure to be here.
So, Pranjul, let's break this down today. Healthcare experts and providers are constant companions throughout pregnancy up until childbirth. Hence, choosing who will help the mother throughout this prenatal stage, the various trimesters, labor, delivery, and the postpartum period is critical. Today, there are various healthcare options available for childbirth in India. We have multi-specialty hospitals, maternity hospitals and clinics, birthing centers that focus on the midwifery or the collaborative model of care. Could you shed light on each of these options and how they're different from each other?
So I think if we look at bigger cities, even B towns, multi-specialty hospitals are really popular these days. And there are some very good names, very good brands, that have their multi-specialty hospitals. And the benefit of them is that you always have a large team of experts and doctors available there. Multiple disciplines are catered. So if your newborn has a problem, it will be solved there only. Or if you develop any other complication, it can be handled. So a multi-specialty hospital is basically what it says. It spreads across multiple specialities, and it's more like wholesome, like a more holistic, wholesome care. But the disadvantage of those hospitals is, I think, less personal care and more of a busy vibe. So that's where small maternity homes or small maternity hospitals come into place, which are basically women focused, and they are often run by a team of gynecologists or obstetricians where the main focus is giving birth or solving gynecology related issues. So there are certain hospitals which only are focused towards maternity and and maybe gynecology. So that's the second option. And then we have even smaller midwife-led maternity homes, which are like quite tiny in size compared to a larger hospital. But it's always recommended in India to have a doctor on call if you're going to a smaller home, a smaller nursing home with a midwife or, a doula, taking charge of the process.
Interesting. And I think slowly there are a lot of these birthing centers or midwifery centers that are popping up, and there's a little more conversation that's happening around these spaces. But like you said, I think they're not as mainstream and not as sought after just yet. And most people end up choosing a maternity clinic or a multi-specialty hospital for childbirth. And that's true. So how does a mother decide what's best for her and her family? And is there a guide or a list of things to consider while choosing a practitioner or an optimal birth setting?
So I think the most important thing, I think that's a very personal choice of what you want to choose. But as a childbirth educator, my advice would always be not to depend on this one particular doctor or this one particular, person for giving birth, because ultimately that doctor is a human too. And what if the person goes on holidays or falls sick? What will happen to your plans? So my advice would always be choose a center or choose a hospital where you are you kind of are in a working relationship with the entire team of doctors available there, and make sure you have an alternative doctor taking care of your delivery process. It should not be a one man show, because that's what leads to panic at the end, and then unnecessary induction of labor, or unnecessary cesarean, where the doctor is going on a holiday and the doctor is like, hey, I'm not available, it's best just to come and get the baby out before I leave. That should not be the case. So it should be a team of people looking at you, and not just one person responsible for your birth, for your delivery and birth. The other thing is that you should do your research and choose a center or choose a team of doctors where the cesarean rate is low. And the hospital must be maintaining records that we know whether they are delivering the babies by vaginally or through cesarean, and how many women took things like epidural or were assisted to have a vaginal birth. So get into those numbers, understand that how many women were encouraged to have vaginal birth, or how many were encouraged to have a cesarean, etc. Ask your doctors the correct questions. Like, ask them that, okay, I have noticed that in the past 1 month 30% of your clients had cesarean. Could you tell me why? There's nothing insulting about it. It's just your right to know what is the reason behind those numbers. So research and go for a place which fulfills your criteria. I mean, if you want to if you want to go for a vaginal birth, then choose a center which has more rates of vaginal birth.
That's interesting. And could you talk a little bit about how to ask for these numbers? Do you just walk up to the hospital staff and just ask for these numbers? Are they willing to share these numbers with anybody?
They should be. I mean, if why not? I mean, it's nothing related to privacy. So just
Mhm.
maybe go to the head nurse and request that information. Or if that seems a little difficult, then maybe go to the doctor and ask about her view on cesarean, and ask her view on induction, because induction of labor often results in cesarean or more complications, where where more assistance is needed in childbirth. So ask her views about all these topics, that in what case would she go for something as severe as cesarean, or in what case would she go for inducing the mother to bring in contractions. So understand her viewpoint and see if you agree with it. And of course, I mean, your doctor should answer this. It's sort of your right.
Interesting. And say you go pick out a hospital or a clinic that's aligned with your philosophies and that's aligned with your family's philosophies, and you do all of the research, but still, people tend to overlook things, or things tend to fall through cracks. Are there any common mistakes that parents make when they choose a healthcare provider, and how can they be avoided?
So it's very common for parents to just, go to the most popular hospital in town, even if it is, like 20 kilometers away from your home, it doesn't matter. That's the place to be, Instagram worthy place to be. But that's a very, very big mistake, I think most doctors are equally qualified, so have faith in your doctor. And instead of going for the most popular one, go for the one who's readily available for you, who's there to answer your questions, and who satisfies your own personal needs. Check whether the hospital setting or the doctor is providing baby friendly initiative, where they encourage breastfeeding, they encourage skin to skin contact after giving birth. A check, it's a small thing, but suppose you have strong food preferences, check whether during your hospital stay, what are the food policy, would you be getting enough nutrition, or is outside food allowed. Check, if you want to say hire a doula to help you during your delivery. Check the policy whether you can bring in a doula, or if you want your husband to accompany you, check their policy regarding that. So these are very small points, but they really do matter in your whole birthing experience. So instead of going with the most popular one, go for the one which is like practical for you and which gives you comfort. And then there are other common mistakes that parents make, like they often go for traditions over medical science. So my advice to everyone is that traditions, cultural beliefs have their own space, have their value, have their space, but they should never ever topple what is being advised medically. So make sure you do that. Right now, I mean, I'm seeing there's a trend that many women believe that cesarean is the easy way out, because you get the epidural. Many times you don't feel a thing. Many times cesarean is done before your labor even begins. So effectively, it's for that moment, it's like a painless way of delivering. But that's not true. It's a very major surgery, and one should not believe that cesarean is the easy way out. It is the harder way out. So just don't insist on getting cesarean surgery just for the heck of it, or because an astrologer asked you to deliver the baby on a particular date. So that is also very common in India these days. So take care of that. And many times mothers, they just go for the most popular star doctor in the vicinity, and ultimately their delivery is conducted by the junior doctor or the head nurse on call, because the doctor is too busy. The doctor is a human too. So instead of going for a very busy doctor, go for a doctor that you can see is available for you, and who's not making you wait 3 4 6 hours in the while during your checkups. So that's a very good indicator. If you're waiting 6 hours to see the doctor, that means the doctor is just too busy to maybe handle your case. So maybe go for the less popular but equally qualified one.
Interesting. Yeah, those are all, like you said, minor things that kind of tend to fall through cracks, but I can see how each thing could add up, on the final day. And you brought up C-section or cesarean surgery, and let's double click on that. Let's talk a little bit about all of the different ways childbirth can really happen in. And from research, we've realized that there are 3 different ways childbirth can happen in, right? So there's natural, unassisted childbirth, where the process promotes minimal interference or less invasive monitoring. Then there's assisted childbirth, where forceps or suction cups are used to deliver the baby when the baby's in an awkward position, or there are concerns about the baby's heart rate, or the mother's too exhausted. And then there is the delivery by C-section, where baby is delivered via incisions in the uterus and the abdomen. In line with global trends, India has witnessed a sharp rise in the cesarean section rate. And I want to take some time to talk about this, talk about why this is important, and why, as an individual or as a mother, someone should care about it, and why today this is turning into an epidemic, and why we should talk about it. So, yeah, over to you.
So I would like to start this off by saying that assisted birth or cesarean is not an evil thing. In fact, these days, maternal mortality rate is at an all-time low. Infant mortality rate is at an all-time low. We barely get to hear incidents about the mother or the child dying during childbirth, which is fantastic. And the credit of all that goes to the new medical care that has come up. The credit goes to the assisted, delivery methods and things like cesarean section surgery, which is there, because of which, if the mother is in distress or if the baby is in distress, a surgery can be done and their lives can be saved. So it's a fantastic thing. But it's a fantastic thing when done for a mother or a baby in need. It's not a fantastic thing to be done unnecessarily, because at the end of it, it's a very, very major surgery, and around 6 layers of your abdomen and uterus wall are cut. So this is not something you do just for fun, or just because your doctor is going on a holiday, or just because you want your baby on a particular day of 2nd February 2022. These are not the reasons to be doing it. And it really concerns us, because WHO predicts that close to 15% of women can have such complications where either the baby is in distress, or there are things like fibroids blocking their birth canal, or there are things like heart diseases in the mother, things like that, where assisted birth or cesarean is required. But unfortunately, in India, close to in big cities where we have some data, we can record some data, close to 47% women are going through cesarean these days, and this number is far too high. I mean, I personally refuse to believe that 47% of us are so sick that we cannot give birth naturally without any assistance. I'm sorry, that is just off. That's just not true. And even if and all over the world, I mean, in many countries like US, India, at least 1 in 3 women are giving birth via cesarean. Uh, Even if we look at the small towns and the villages, we are pretty confident that nationally, at least 1 in 3 women are giving birth via cesarean, which is not a good number. I mean, many times I think it is believed that a cesarean is not needed, and it is done only to hurry up the process, or only because the mother is feeling, psychologically a little worried. She wants to hurry up things, or the doctor is a little impatient. So those reasons are not good enough to carry on such a major surgery.
Interesting. So, as a mother, what are the various steps that someone can take to avoid C-section in unnecessary cases? If it is required, it is required. But what are the different ways a mother can make sure that it's avoided if not required?
So the first thing would be that please don't feel shy asking the correct questions, with your doctor, like just discuss this openly. Please be sure to inform your doctor about your birth plan, about your wishes, and a good doctor will listen, will understand, and probably encourage a good birthing plan. So discuss your wishes, discuss your fears with your doctor. The second important thing is that, be healthy. Like if you are pregnancy is not a disease, it's a very, very natural way, of life. And during those times, just don't take extra rest. I mean, unless your doctor advises you to. I mean, just remain healthy, move around, exercise if your doctor permits you to, eat healthy, uh, and be active till the last moment when you are going to, deliver. So this is not, pregnancy is not a card for you to just be on bed rest, which many women believe. So being healthy is also equally important, and doing the correct exercises. So I'm not expecting you to suddenly become a marathon runner, or a fit sports person during a pregnancy. No, I mean, if you are a moderately active person, all I'm asking you to do is, if your doctor permits, remain moderately active all throughout your pregnancy. Just don't stop doing what you were already doing. you know. So and of course, read books, understand what the process is all about. Just don't take things at face value that is coming from your friends or well-meaning relatives. Research, ask questions, inquire about it.
Interesting. And honestly, this podcast is one of the attempts to start conversations about things like this. So, the idea is to take all of these topics, do a little bit of research ourselves, condense it into a more digestible format. So, it's easier for mothers to be more aware of issues like this. But yes, doing research, I think, goes a long, long way. Do you have any resources that you would recommend mothers would look at, or do you have any resources that you would recommend families look at?
So actually, internet is a very dangerous entity these days, because there is so much information, and it's very hard to decipher what is actually true, what isn't, and some of it is so false that it is to the extent of being dangerous. So what I would really suggest is a lot of governments all around the world, they actually have a lot of information on their own, medical websites, like for example, UK has a lot of information on NHS, National Healthcare Service site, where you can just go and see what the UK government recommends, or what the Australian government recommends, or what when it comes to newborn care, what the American Association of Pediatrics recommend. So my thing is, whenever you're doing your research on the internet, go for a medically verified website where doctors, qualified doctors, or the state governments are recommending something. Just don't go again for a one man show where some expert, some self-claimed expert is saying something. Don't even listen to me, but just go for something which is backed by medical research, by government of countries, or by well qualified doctors. A lot of hospitals these days give a lot of data too, when it comes to healthy pregnancy and the exercises most women can do after consulting a doctor. So I think a lot of leaflets and all can come from your local healthcare setting also.
This has been an extremely insightful conversation. Thank you, Pranjul. Thank you for sharing your thoughts on how to choose a care provider for childbirth. It was great having you on Amra Circle.
Thank you so much. Thank you for running this initiative where you are informing women. I think it's a beautiful cause. Thank you so much.
Hello and welcome to Amra Circle. I'm your host Deeksha, and I'm so excited to introduce this platform that brings parents, educators, and experts together to discuss all things parenting. For we all know it takes a village to raise a child. This podcast will shed light on different issues, questions, and topics relevant to the early parenting community. Enjoy our musings every week as my team and I take pressing parenting topics and break them into 20-minute episodes. Subscribe to Amra Circle on Spotify or Apple Podcast or wherever you listen to your podcast so you never miss an update.